In medicine, confusion costs marks and mistakes cost lives. Stop memorizing, start understanding. This is IBM, where medicine finally makes sense. And today we'll be talking about the bones of the upper limb, the anatomy of the bones in the upper limb. And right on the screen, we have the clavicle. The clavicle. So the clavicle is a modified long bone that acts and connects the trunk and the upper limb. It is the link between the appendicular skeleton and the axial skeleton. Important thing you should know about the clavicle is that it's the first bone to ossify, in the body, and usually the last one to be fully formed. Usually one of the last to be fully formed. The site that you have is that you have the medial side, which is large and chondrologular. Is large, the medial side. So you can see the medial side here, right? The medial side where it articulates with the sternum to form the sternoclavicular joint. Then you have the lateral side, which is flattened, right? You can see the lateral side is flattened. Then you have the shaft, which is usually from here it runs, and there's a junction. You have the medial 2/3 and the lateral 1/3. Now this junction between the medial 2/3 and the lateral 1/3 is usually the point or the site of fracture. Now it's very important you know that the medial aspect is convex anteriorly, while the lateral aspect is concave anteriorly. The inferior surface of the lateral aspect shows the conoid tubercle, and it also shows the trapezoid line. You can see them here, right? Then for the medial aspect, the inferior shows the impression for the costoclavicular ligament, right? So this is what you have here, right on the screen. Very, very important. Now the medial end articulates with the sternum to form the sternoclavicular joint. It articulates with the manubrium of the sternum, while the lateral end articulates with the acromion to find the acromioclavicular joint. Now usually the muscles that are attached to the clavicle are the sternocleidomastoid, the pectoralis major, the deltoid, the trapezius, the subclavius, which are all indicated: sternocleidomastoid, deltoid, pectoralis major, subclavius, trapezius. Right. Now the clavicle has two primary centers for ossification, and it has one secondary center. I told you earlier that it's the first bone to ossify in the body, and usually the last one to be fully formed, because the medial epiphysis fills at about 25 years. Now the clinical correlation you know for the clavicle is the site of fracture. Like I told you earlier on, the site of fracture is usually at the junction between the medial 2/3 and the lateral 1/3. And if there's a fracture of the clavicle, what is usually, there are vessels, for example the subclavian vessel can be injured. Alright, so the next bone we have is the scapula. The scapula is a triangular bone. You can see it on the screen. That is on the posterior thoracic wall. Usually forms the posterior part of the shoulder girdle. So it has a costal and anterior surface, a dorsal surface, right? It has a superior border, a medial border, and a lateral border. It has a superior angle, it has an inferior angle, and it has a lateral angle. So this is the lateral border, this is the medial border. Usually the superior border is around here. Then this is the superior angle here. Then you have the inferior angle here, which is indicated here, right? And then you have the lateral angle too. So it has two processes. You have the acromion and the coracoid process. The acromion is the most elevated process. You can see the acromion, and this is the coracoid process. Now the articulation, it articulates with the humerus to form the glenohumeral joint. The glenoid cavity of the humerus of the scapula articulates with the humerus to form the glenohumeral joint, which is the most mobile joint of the body. The muscles that are attached are usually the rotator cuff muscles, the trapezius, the deltoid, the rhomboid, the serratus anterior. Now the surfaces that you have, like we spoke about earlier on, is the subscapular fossa, which is the anterior surface. So this is the subscapular fossa. In the posterior aspect, it is divided by the spine of the scapula, where it projects to form the acromion, which is the most elevated portion. And then you have that spine of the scapula dividing it into two. You have the supraspinous fossa and you have the infraspinous fossa. So these are things you should know about the scapula. Now the scapula usually fractures around the surgical neck, and if there's a winged scapula, you should know that the nerve that is usually injured is the long thoracic nerve. That's the anatomy of the scapula. Alright, so next bone is the humerus. Now it's important you know that the humerus is the longest bone in the upper limb. It's a long bone of the arm that connects the shoulder to the elbow. So you're looking at the humerus. It has a proximal head, it has a distal end, and in between there is a shaft. The proximal end has an head. It articulates with the glenoid cavity to form the glenohumeral joint. It has an anatomical neck. It has greater and lesser tubercle, and it has the surgical neck. The shaft has a deltoid tuberosity and a radial groove, and then the distal end has a capitulum, a trochlea, an olecranon fossa posteriorly, and then that's a coronoid fossa. You should note these parts. And then it has muscles that are attached. The muscles that are attached to the humerus are the rotator cuff muscles, the deltoid muscle, the biceps, the triceps. All of these will be completely discussed when we discuss muscles of the upper limb. Now, the clinical correlate you should know about the humerus is usually the site of fracture is the surgical neck, and if there's a surgical neck fracture, you have a damage to the axillary nerve. Then you have mid-shaft fracture that causes damage to the radial nerve, which results in radial nerve palsy, and you have the supracondylar fracture, which causes brachial artery injury. So this is the anatomy of the humerus. Take note. Alright, so the next bone we'll talk about is the bones of the forearm, which is the radius and the ulna. We'll start by talking about the radius. The radius is the lateral bone of the forearm that is usually involved in pronation and supination. It has a proximal end, it has a middle shaft, and it has a distal end. The proximal end, like you can see, is made up of the head, the neck, and the radial tuberosity. The shaft has an interosseous border that forms the interosseous joint in connection to the ulnar bone. And then the distal end is made up of the styloid process, the radial styloid process, the ulnar notch, and the articular surface for carpal bones. That's radius. Then the clinical correlate usually is Colles fracture. There's a fracture, usually causes Colles fracture. Alright, the next bone is the ulna. The ulna is the medial one and it's the longer one in the forearm. The ulna stabilizes the elbow. It's made up of the proximal end, the shaft, and the distal end. The proximal end has an olecranon for articulation with the humerus. It has a coronoid process. It has a trochlear notch. Then the shaft, just like the radius, has an interosseous border, and the distal end has the styloid process. Clinical correlate is usually olecranon fracture and the nystic fracture. So that's the anatomy of the radius and the ulna. Alright, so next up we have the carpal bones. The carpal bones are the bones that make the wrist, and there are 8. They are arranged in proximal and distal. The proximal rows are 4, the distal rows are 4. The proximal row are scaphoid, lunate, triquetrum, and pisiform. Scaphoid, lunate, triquetrum, and pisiform. The distal row are trapezium, trapezoid, capitate, and armate. The acronym is She looks too pretty, try to catch her. She looks too pretty, try to catch her. She looks too pretty, try to catch her. She is scaphoid, looks, lunate. 2. Triquetrum, pretty, pisiform. Try, trapezium. His note is zium before zoid. Then 2, trapezoid, catch, capitate. Ah is armate. She looks too pretty, try to catch her. So proximal and distal. Now, important details you should know is the pisiform is regarded as a sesamoid bone. Sesamoid bone. The largest of all the carpal bones is the capitate, but in the proximal row is the scaphoid, right? And then the armate is regarded as the hook of armate. Now, you should know about the carpal tunnel syndrome when there's a compression of the median nerve that's passing through the carpal tunnel. And if there's a fracture of the scaphoid, it is regarded as avascular necrosis. These are key points that you must know for every medical exam. Next on, we'll be talking about the metacarpals. The metacarpals are the 5 bones that make the palm: the first, second, the third, the fourth, and the 5th metacarpals. They are made up of head, shaft, and base. Now, it's important you know that of all of these, the stoutest is the first metacarpal. Is the stoutest. It's very, very important. Now, you have a fraction of the 5th metacarpal, is usually known as the boxer's fracture. Boxer's fracture. Then the next one is the phalanges. Now, it's important you know there are 14 phalanges. Of that 14, there are 2 on the first finger, which is the thumb, and 3 on each. So this is 1, 2, but this is 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So those are the phalanges. Next on, we'll be talking about the joints of the upper limb. Thank you for joining us. Now that's how this concept should be understand, clear, precise, and exam ready. If this helped you, go ahead, like the video, drop a comment, and tell me what topic you want next. This is Dr. ABM, where you don't just study medicine, but you master it.